Hi, my name is Pedro Gask and I'm a physical therapist at Baton Rouge Rehab Hospital. Today I'm going to teach you a method to use a simple ACE wrap to improve ankle dorsiflexion and eversion in patients presenting with foot drop that is limiting or impeding the quality of their gait.
Foot drop can be defined by the inability to efficiently raise the front of the foot off the floor, resulting in toe dragging when walking, which could cause the patient to fall. Foot drop causes the patient to walk with excessive flexion of the hip and knee, called steppage gait. Foot drop in itself is not considered a medical diagnosis, but rather a symptom of an underlying problem that could have a variety of causes, such as damage to the central nervous system, like a head or a spinal cord injury, an orthopedic injury resulting after a hip or knee dislocation, a progressive or acute neurological disorder like Parkinson's, muscular dystrophy, ALS or Guillain-Barré, or even damage to the peripheral nerves or muscles themselves, such as sciatic nerve impingement or damage to the peroneal nerve. In order to effectively treat foot drop, the underlying cause should be addressed first and foremost. Therapists will typically utilize a variety of treatment strategies to attempt to improve the strength and coordination in the lower extremity muscles responsible for moving the ankle as part of a comprehensive rehabilitation plan that also includes gait training and, as needed, recommendations of braces to support the foot on either a temporary or permanent basis. The most common brace used for patients with acute or chronic foot drop is an ankle foot orthosis, or AFO. These are firm supports used to manage the position or mobility of the ankle and to provide efficient toe clearance during the swing phase of gait. They typically feature a frame that fits into the shoe and extend up to just below the knee. They can be purchased prefabricated, off the shelf, or sometimes need to be custom made to meet the specific needs of a patient. If you are trying to decide if an AFO is needed for your patient, are waiting for one to be made or delivered, or want to temporarily facilitate improved ankle positioning for a gait training session, you can use an elastic ACE wrap to promote improved ankle dorsiflexion and eversion. This technique should not be used to replace an AFO if one is needed on a long-term basis, but rather should be used as a temporary support during a therapy session if an AFO is not immediately available. Have your patient seated in a chair or on a mat with their feet resting on the floor. The patient should be wearing comfortable, well-fitting shoes. You will need a 4-inch ACE wrap and potentially some tape to secure the ACE wrap to the shoe. Assist the patient to raise the front of their foot to the desired angle and support the ankle in that position using your own foot or leg. It is important that the patient remains in this angle the entire time you are placing the ACE wrap. To begin, hold the ACE wrap against the shoe with the bulk of the roll on top of the wrap, like a snail. Start with the wrap on top of the foot around the toe box and unroll it towards the inside of the foot and back around 2 times. Once you have the roll on the lateral side of the foot, start bringing the ACE wrap up the outside of the leg all the way up to just below the knee. Use a sufficient amount of tension to achieve the desired angle of dorsiflexion. At this point, you will place your hand inside of the ACE wrap between the bandage and the skin and support the wrap with your thumb while you bring the roll forward and continue unrolling on the front of the leg. Bring the ACE wrap all the way around the leg and come back under your hand to loop around the lateral portion and create an anchor on the side of the leg. You will then wrap once more behind the leg and bring the ACE wrap back down the medial side of the leg all the way down to the foot. Don't worry too much about providing a lot of tension at this point, as we are wanting to balance the ankle and avoid pulling it into inversion. Bring the wrap under the foot at the toe box and follow your initial wrap up the outside of the leg and repeat the same looping technique done the first time. This time, however, once you bring the wrap back around the back of the leg, simply anchor the Velcro at the top of the leg. In most patients, you will wrap the foot and upper leg twice, have 1 layer of support down the inside of the leg and 2 layers on the outside of the leg. Always double check that the resultant ankle position is comfortable for the patient and at the desired angle. When done correctly, your patient should still have some degree of available movement at the ankle and rest at a neutral ankle position. If your patient has a longer leg or a larger circumference at the foot or knee, you can skip the first 2 wraps around the foot and simply tape the beginning of the wrap to the bottom of the shoe to save some length of the ACE wrap for the more crucial steps. This is a low-tech, temporary solution to a complex problem that gives you the added benefit of adjustability, cost-effectiveness, and access, as most therapy clinics and hospitals have ACE wraps readily available. When working with patients who have sensory or circulatory impairment, such as those with compartment issues, excessive edema, or vascular dysfunction, exercise caution and ensure that you are checking the skin frequently, minimizing compression, and only leaving the ACE wrap on for short periods of time. I hope that this video has helped you to advance your clinical skills in treating patients with gait disturbances caused by foot drop. Be sure to check out our website at www.brrrehab.com for more helpful videos in our Real Rehab Skills video series.